and had one of the very first multidisciplinary practices in the country. So we're talking about late 80s.
Wow.
And it was really kind of groundbreaking stuff back then. It was unusual. And, now it's sort of mainstream, and collaborative care is the way of the future. But back then, medical doctors and chiropractors didn't even play golf together in the same country.
You're right. Yeah. Let alone work together. Yeah. Genesis Nation, welcome again. I am really honored, proud, and excited and curious to talk with Dr. Mark Sanna with Breakthrough Coaching. And I've had the recent privilege of getting to know you personally and meet you face to face. And I didn't get to meet you while I was in practice, and I want to know what I missed out on. But if we can start, we're sharing with our Genesis Nation. Many of the people watching here, we're all users of Genesis. We're users, and I want to be able to expose them to everything that's possible to get the best out of their practices for themselves, and also to help propel and amplify the profession. So if you can start with your history, please tell us, how did you get started with Breakthrough?
Well, thanks so much, Brian. And it's great to be here with you. And folks from Genesis have been so supportive of chiropractic, an amazing software platform. And I've known Brian Kapp for many years, and he's the workflow master in my eyes. And
Nice.
to be able to take this software and surround it with such an amazing team, and have some of the really cool integrations that you have with some of my buddies like Jay Greenstein and his app, and all kinds of Canvas app, and all kinds of cool stuff. So give you a little thumbnail on me. So I'm a chiropractor. I think you have to say that first, because people don't necessarily know that. Actually, second generation chiropractor. So,
oh, wow.
My dad's chiropractor as
That's
well.
cool.
And still gives a heck of an adjustment at
No
the
way.
age.
That's
Really,
awesome.
really amazing. And so my history in chiropractic is I started as a chiropractor up in the state of Connecticut, practiced there for many years, and had one of the very first multidisciplinary practices in the country. So we're talking about late 80s.
Wow.
And it was really kind of groundbreaking stuff back then. It was unusual. And, now it's sort of mainstream, and collaborative care is the way of the future. But back then, medical doctors and chiropractors didn't even play golf together in the same country.
You're right. Yeah. Let alone work together. Yeah.
Or work together. And so developed this model. I had a great company that was managing my practice called Breakthrough Coaching. So I was actually a client of the company. And the guy who owned the company, Brian, back then, another Brian, said, "Hey, Mark, I think you'd be a good coach. Would you be interested?" I'm like, "Are you kidding? It's what I wanted to do my whole life growing up, going to Parker seminars and, with my dad." And so after about 3 years of working for the company, Brian, I'm practicing full time, right? So getting in the office 7:30 in the morning, leaving the office 7:30 at night, and coaching 75 practices, seriously, myself.
Wow.
Right? And
So this is after 8 o'clock at night. So you were grinding hard.
I was grinding. And so Breakthrough Coaching was like on the a dining room table. So if we had company come over, I'd have to put Breakthrough Coaching into a closet and all that back then.
Yeah.
Really amazing. But so I'm working my butt off. This guy's making all the money. And so I took him out to lunch. I said, "Brian, I want your job." And he said, "Awesome. I want you to have your job, my job." And I bought the company from him. That was in 1998. Immediately moved out of Connecticut down to Miami, Florida, which is where I am today. Awesome. And we expanded to become a company that just started in the Northeast, New York, Connecticut, New Jersey, Pennsylvania, to a national and now actually an international company with a team of consultants. And it's really been a joy. It's almost coming up on 25 years
It's
of
awesome.
managing, chiropractic and multidisciplinary practices.
What I love, your history just holds so much weight because you've cleaned the toilets, you've swept the floor, you've adjusted the spines, you've fired and hired the staff, you've
Yeah.
done it. You've been in the trenches, and that's like I've worked with consultants who have never even put their hands on somebody. So it's a totally different, you're getting different value from different people, but I feel like your experience and wisdom and intuition, especially being a second generation chiropractor, you just offer something really unique. And are your clients only integrated practices, or are you dealing with strictly, or is that how does
Yeah,
that work?
about 40% are integrated,
Okay.
and the rest might never have a desire to go integrated, and that's fine. We certainly don't push them that way. If they're going to do integrated, we're actually pretty strict about who we allow come into that program, because you've got to be ready. You have to know how to run a successful chiropractic practice first
Yes.
before you can even think about bringing in a PA, nurse practitioner, other providers, because you're going to blow things up. You'll crash the
And
ship.
I've experienced it myself. It's a different level of, you're managing different types of employees and different levels of training and thinking. Their
Yeah,
mindsets are totally different. Yeah.
and big time different level of overhead, right?
Yeah.
So
That's the huge piece. Yes, sir. Yeah. So you got to
so
generate the revenue to
e-
beat that.
exactly. So we really look for docs who are, 5, 15 years in practice. They've had a successful chiropractic practice. You're not going to do multidisciplinary as a startup, unless you've got a really rich uncle or daddy or something like that.
Yeah.
um, but the bottom line is you got to know how to run a team, run a practice, know systems, document systems, implement systems. The biggest thing is I see a lot of docs being taught now, just add a nurse practitioner or a PA to your practice and start doing whatever stem cells, and you're going to make $300,000 a year. And I'm like, it's not quite that
Yeah,
simple.
there's a lot. There's an A through
Yeah, there's a
Z.
few
There's an A
steps.
through Z. Yeah, or A through Z to get there. So what would you say, because we're just talking generally, what are the three biggest pitfalls that you've seen, or roadblocks that people run into?
I think, first of all, number one, it's personnel, right? So if you're going to add professional licenses to your staff, you as a chiropractor can't be intimidated by them. You've got to interview them just like you would anybody else. I don't care if it's an MD, a DO, a PA, nurse practice, it doesn't matter. They're still people. Your core values, your work ethic, your vision for the practice has got to be all on the table up front. Here's the philosophy of the practice. It is, for example, to get people off drugs, not put them on drugs. Now that's
Yeah.
a big difference from somebody who says, okay, I want an urgent care practice and we're going to vaccinate people, right? So that's a completely different mindset. I come from the wellness background, the collaborative background. I happen to know that what we have in chiropractic is true healthcare.
Yes.
And what medical has is sick care.
Mhm.
So when you put the chiropractic philosophy and you complement it with some of the other medical procedures that are in alignment with the concept that the power of the body heals the body, right? That we're removing interference, right? Then you have a very easy GPS. And here's what we're going to add to our practice. Here's what we're not going to do in our practice, right? So, number one, hiring the right people. Number two is teaching collaborative care. And I see many multidisciplinary practice that act like silos. In other words, there's a
Yeah.
silo of chiropractic, there's a silo of nurse practitioner,
And
there's a
there's
silo,
like no cross referrals and
no
co-treatment
cross
and yeah.
referrals. Nobody knows what anybody else is doing. And so understanding how the chiropractic evaluation, which is the starting point for most cases, you're going to have some who will come in directly for medical, but for most cases, that's your foundational business. You're going to be looking at your patients in a different way. So, to give you a really quick example, patient comes in with low back pain, which many do. Chiropractor is going to look for the subluxation, rule out any pathology. Many stop there. And that's sort of an insurance mindset, right? I've got to get be in
Treat
that
one
box,
condition. Yeah, yeah.
right? Diagnoses, etc. However, we know as chiropractors, we're a closed kinetic chain. Feet hit the floor, right? And so if
So
I'm
glad you
having
said
low
that.
back pain, I got to look at the knees.
Yeah.
I've got to look at the feet. If I don't do that, I'm missing out a big part of what I can do in the overall health and longevity for this patient now that I have these new multidisciplinary tools. So we know many patients who have low back pain, especially if they're carrying some extra weight, which most people are going to have a situation going on in their knees.
Yeah.
And so we give them an outcome assessment questionnaire. It's a Leishholm scoring, and it's a real quick test that allows us to say, hey, you know what, maybe we should take a couple of views, x-rays of the knees, and
Yeah.
let's see if we've got some early OA going on there, because we know if we get in front of osteoarthritis early and use the right treatment parameters that are available to us now in multidisciplinary, that may start with something simple like putting some articular fluid, HA, into the joints for lubrication.
For
Or
those listening, HA hyaluronic acid, or I always call
yeah,
it visco supplementation, yes,
visco supplement, yeah,
which is typically covered by insurance
and that's
and
right, and
Medicare. Yeah.
that's yeah. So hyaluronic acid is the big component of the articular fluid in your joints, right? And it dries out as we get older, thins out,
Yep.
I should say, and that's not a good thing. But you can put that back in, and
Every
that
6 months.
being that being done. So it doesn't fix the problem, right? It
Correct. Yeah.
delays it.
Yeah.
It delays it. Fixing the problem would mean we're going to go in there and use some of the new regenerative tools, like something called A2M or alpha 2 macroglobulin. And A2M,
Yeah.
imagine proteases or enzymes that actually eat and degrade the articular cartilage. A2M goes in and binds with them and stops that process.
That's awesome.
It's so amazing, the
And
technology.
this something like I mean, I'm going to keep pulling on this thread because this stuff really intrigues. Like I'm just super curious about it. So A2M is an exogenous product, meaning like you have to get it, take it outside. It's different than like a PRP or a bone marrow.
Yeah, it's the step just before PRP. So
Okay.
if you do PRP and you miss A2M, it's like putting in the healing factor, which is PRP, which is the platelets and the growth and regeneration that affects, without stopping the process. So you got to stop the process.
So you're still
first.
getting breakdown, but
So,
like you're putting in these healing elements. So I love it. But now, and I'm also thinking, okay, business like processes, right? You've got visco supplementation, you've got A2M, then you've got PRP. And then if those don't work, then you've got
then you bring in Wharton's jelly, because
signaling cells. I don't like to call them stem cells because I know that's a misnomer.
Yeah, we don't say it's a bad word now. But imagine that. So you now have a patient who is 60 years old. They smoked and maybe they have blood sugar. Their platelets are not going to be any good to them.
Right.
And so then you have to have some sort of an exogenous factor put in, umbilical cord nanoparticles. We call it Wharton's jelly.
Okay.
And those are mesenchymal undifferentiated cells. You put them in and they can actually morph into articular cartilage or ligament or
now in breakthrough coaching, we could like really dive into this. I don't think this is the appropriate, but you and I definitely have to geek out on this because I love talking about it. But from an overview perspective on breakthrough coaching, do you
Yeah.
offer the scientific education behind these things as
Yeah.
well?
So,
Because it's
yeah,
because like a lot of people, and even in my experience, like I've had to train nurse practitioners. Not necessarily, I can't train them in injecting and things like that, but I had to train them in these concepts of regenerative
it,
medicine. Is that
exactly.
something you
And
guys offer?
100%. And most importantly, having the coordination and the communication between the chiropractic, let's call it department, and the medical department, so that there actually is called a treatment map or algorithm or protocol, so that this is how we manage our patients in our practice, so that we're giving them the very best care possible.
And it works in both directions too. If they're starting the chiro and like they're quote unquote a low back and you're checking knees, but they could come in the funnel through knee pain
Come in with
and
a
then
knee.
be referred up the algorithm to the chiropractor. So
Exactly correct. So,
it all works in tandem there. That's
so,
awesome.
so, yeah. So teaching everybody what a closed kinetic chain is, how each area is impacted, and then what the science indicates. So you mentioned or alluded to the stepwise protocol, beginning with viscose, moving into A2M, moving into PRP, moving then into maybe Wharton's jelly, and then maybe even moving into exosomes, right? Which is a whole different thing to talk about, but extremely cool. And so having that protocol that everybody knows about, it's not like we're hitting and missing. This is how we process patients in a collaborative environment, right?
Love
So
it.
we're actually meeting, we're actually doing grand rounds, we're actually discussing patients, because not only is it enough to then treat the OA, there's all kinds of deconditioning that uh, correlates with that, meaning we got to stretch them and we got to strengthen the muscles, right?
Yeah, and I heard you say the word grand rounds, which is something that we didn't learn as chiropractors, but as an
Yeah,
integrated practice, it's and my mind also says, okay, we got task checklists. So did we see the PA? Did we check the knees? Did we give the questions? Like all these things, boom, that's a Genesis thing. And then
that is
also
totally
and
Jenna's
and
thing.
and the documentation as well, because your
Yep,
documentation can you're in the same screen, you're looking at the medical note, you're looking at the physical therapy note, you're looking at the chiropractic note. With your practices, have you found? I may be off topic here, but this is like I'm very intrigued. Sorry, so I'm hoping everyone else here is liking this. Do you tend to integrate just with PAs and Ps like on the medical side, or are you also integrating with physical therapists different than
yeah,
chiropractors? Is that a commonality?
it very much is. So typically we'll bring in a PT and then a PA or nurse practitioner.
Okay.
And once you fill up a PT, seeing 20-ish a day, that's a PT who's
They're humming.
kicking,
They're
they're
humming.
humming.
Yeah.
Um, then you bring in a PTA, right? And so that for most practices, if you have a Medicare population, adding that PT, about 6 patients a day pays the salary for that PT. So you're
Yeah.
even at 6 patients a day. And think about it, you take a chiropractic adjustment under Medicare, maybe $50 on a good day.
Oh, that's a good day.
Yeah. Okay. But
I'm
add to
I'm in the
that,
when I stopped practicing, and this is only a couple of years ago, it's in the 30s. So yeah,
I
50 would be
know,
great. It's
but
really
add
sad.
to that PT exam, couldn't get paid for as a chiropractor. Add to that your x-ray films, couldn't get paid for as a chiropractor, your exams. And then add to that 3 units of physical therapy, Therax or Theractivities or neuromuscular rehab. Now I got a visit that's 150, 180 for a Medicare patient in the bank.
Yeah.
And that's a great, so it's a great step. They're credentialed pretty quickly under Medicare. So that's, you have to, again, I mentioned cash flow. You got to think about how am I going to ramp this thing up versus bringing in a nurse practitioner part-time at 100 something an hour and hit and
Filling their
miss,
schedule. Yeah, yeah. And not
trying to
having them
fill their
credentialed
schedule
and yeah.
and because literally the sky is the limit of the cool things that you can do. You can do IV nutrition, you can do medical weight loss, but you don't start with that. You can do aesthetics. Once you can put PRP in a joint, you can put it in a face, you can put it on a head. Lots of stuff that you can do, but it's got to be done in a coordinated stepwise fashion, or you'll just sink the ship.
I want to key in on that credentialing piece because I've run into that before. I've used very inefficient employees or outfits. We work with Target Coding, Dr. Kotler's outfit. And they're brilliant, and they love it's not even brilliant. They're passionate about credentialing. So I would venture to say that more than 80% of the people listening to this are not passionate about credentialing, and it's completely necessary. Yeah, exactly. That's something farm out immediately. But we have resources for that because we know that it's something that you don't want to get involved with as a CEO or as a treating clinician.
Here's the thing: even as a staff member, you can do the credentialing. It is absolutely tedious. It rarely goes through on the first pass. It comes back. You got to change this. I had this in the wrong place, and it can slow you down. There are places to be efficient with your spending. Your legal structure is not one to fool around with. No. Get a great local attorney who knows healthcare law in your state. I love that.
I'm good. That's like the third tip we're taking away, and that's like a huge one because I've been bit by bad contracts, and that was just my like it was a contract that was okay when I had it written 15 years ago, but laws changed, and I didn't change the contract. So,
for goodness sake, look at the state of Michigan. For the first time, they expanded their scope of practice. It was illegal a year ago to do multidisciplinary in Michigan. And now Michigan is one of the great states for multidisciplinary because their licenses now have parity. So you have to kind of stay up on that. You have to know who's the lawyer in your state. But back to credentialing, right? So you can do it. It's going to take longer. If you screw it up, it delays the process longer. So Medicare goes pretty quick. So get the Medicare in because you're credentialing the facility and then you're credentialing the individual providers under the facility, right? And so you got to get all those folks credentialed. If you're chiropractic, you got to move your credential over to the new tax ID number, right? Because you can't treat out of two pots. There's these amazing thing called the Stark regulation.
Yes.
You can't make money out of two buckets that you own on the same patient, right? So getting that legal setup straight in the first place, and then getting your credentialing done right. Listen, I'm seeing some states, Blue Cross Blue Shield, it's 4 or 5 months for Blue Cross.
And that's hard when you're paying someone $100 an hour. That's challenging.
Exactly right.
So I'm assuming that as a breakthrough client, like you're holding hands and providing this data so that we have a runway to do all this stuff, right?
Absolutely. And so we know how to start the professionals in sequence so that they're generating cash flow, right? So the reason I mentioned Medicare first is the credentialing is fast, and the easy stuff like trigger point injection, joint injection, HA, that's all covered by Medicare. And so and then your PT services under the physical therapist covered by Medicare. So you're generating money right out of the box versus waiting for everything to get credentialed. And now I'm paying this nurse practitioner or whoever for a whole long time without generating service.
And training them. And I know from experience, like quote unquote selling, but you're enrolling people with regenerative medicine. It's a cash procedure. So it's very different than enrolling for an insurance procedure, especially for medical practitioners who are not adept and trained to enroll versus sell.
And they never will be. No, they're great.
That requires another person. That was my role and some other people's roles.
Exactly correct. So if you're the chiro and you're good at doing case presentation, maybe that'll be you. If you have a team member who's good at doing case presentation, that'll be that person. Awesome. But you're talking about selling, a single PRP or a double PRP. You're talking anywhere from $4,000 to $8,000
Yeah, it's a
add
big
a
ticket, way big
add
ticket
a
item versus like individual adjustments or even those care
exactly.
packages over months and months.
So
So
you need to know the why. Why are we doing this? Because we know early intervention is the best. We've caught this early on, and we know what the end looks like, and that's knee replacement surgery. And so you're not near that, but we can keep you from getting there. So that's key thing, knowing the why. And then you have to have ways to creatively finance. Some people can give you a credit card for 6K, some can't. And so you want to have some financing options for patients who have great credit and maybe patients who don't have prime, the best
and
credit.
there are a lot, and you can feed those to people working with you, obviously.
Yeah,
One
absolutely.
one last item, because we're coming up on our time here, but I do want to just mention if we can talk about DME. Is that
Yep.
something? Because that's a big revenue source. It's a high profit margin for a lot of it. Are many of your practices getting the full certification for DME so that they can move, sell and provide products in that way?
Yeah. So this has changed over the period of COVID when the laws became very open for chiropractors to become accredited dispensaries of DME, right?
Okay.
And that window of opportunity for chiro alone has closed
Interesting.
because it is really open to the medical component. So,
So you're telling me it did open for a period of time during
oh
COVID?
yeah, we
Wow,
got a bunch.
that's
We got a
awesome.
bunch of people through in those 2 years of COVID.
Okay.
Um, yeah, and it
That's a
not
blessing.
fun.
That's a
It's
blessing
a
that you didn't expect, I'm sure.
yeah, but for them, I mean, it's hard because
Yes.
you had to take hours and hours of studies online, and then you had to do fitting 50 braces and sending in LMNs and all letters of medical necessity.
Goodness. Yeah.
So in the multidisciplinary practice, that would be dispensed by the nurse practitioner or PA. And then, particularly under Medicare, you have coverage without all the monkey shine stuff that you had to go through as a chiropractor. But very important that people understand, because we often have this misconception of bracing as being immobilization and that's going to decondition the patient. But the more modern concept is actually functional bracing. So
Yeah.
I'm bracing a knee so that the patient can continue to do their activities of daily living, social activities, work activities.
Change, and just like you said, the closed kinetic chain is like you're modifying the chain
Absolutely.
in their way they're ambulating and changing their posture because their knees are destroyed.
And it
Um,
takes time for everything else to catch up. Yep.
yep.
And so having a component of DME is super, super important
Awesome.
and
Awesome.
and good for the bottom line.
You are a wealth of knowledge and experience and wisdom, and I can't wait to just do more of this stuff. I'm gonna cut us off here because just
Wait, one
attention
thing.
span
I
in
got a
general.
cool
Yeah,
thing.
please.
I
Yeah,
got a
yeah,
cool
yeah.
thing. So
When I
I
want
wrote
people
a
to know how to find you too, and we'll put
I
everything in the
I
show notes and all
I
that. But
wrote a
yeah.
new book.
Oh,
Here it
cool.
is. Cracking the Code, Marketing Chiropractic, How
Awesome.
Chiropractors Align Spines and Minds. It is hit #1 chiropractic book right now on
Awesome.
Amazon.com.
Wow.
So
Congrats. And we can find that on Amazon. I'll
right
make
on
sure we put that in the
Amazon.
link too.
If you're not using Chat GPT or AI to market your practice, this is going to show you how to do that and all of the other
Awesome.
beautiful social media, TikTok, etc.
Well, and
Um,
what I'm experiencing just like listening to this, and I'm putting myself, I'm not in practice anymore, but I'm putting myself as if I were. And you've taken all these difficult concepts and seem to make them easier, from marketing to implementing because in an integrated practice is you got a lot of plates spinning at the same time. And if you're not marketing, your
yeah.
practice is dropping. So just this is awesome. Thank you I'm so glad that we're collaborating and able to share this with our audience here.
Thank you, Brian. It's super. And so folks can check me out. The website is called mybreakthrough.com.
Okay.
Spell the whole word BREAKTHRUGH.
I've learned it's one word, but we
Yeah.
abbreviate BTC. So
And
mybreakthrough.com. And
mybreakthrough.com.
the name of the
And
book again was
there's great resources. The book is called Cracking the Code.
Cracking the Code. Awesome. Good. So I'm going to get that out to our people. We'll put everything in the notes, and they can find you through that website if any of our
They can
practices
find me through the
want to.
website, or Google me. It's one of the things of having a unique name like Mark Sanna.
Yes.
I'm the one. That's it. So when you Google Mark Sanna, I come up. It's really easy.
Awesome. Awesome. Well, thank you so much. I look forward to doing more of this and maybe even diving into some topics. So for those of you listening, if you are interested in one topic over another, please like comment in the links below and let us know. And Dr. Sanna and I we'll dive in deep and pull threads on whether it's DME or some other stuff that's within your
Yeah.
wheelhouse. So thank you very much for your time.
Thank you, Brian.